You may have heard me talk about preeclampsia, which is a very serious condition that happens to some women in pregnancy and some women postpartum with postpartum preeclampsia. You may have heard that it's diagnosed with high blood pressure and protein in the urine. And you may think that the only symptom to look for is high blood pressure. Well, I want to bust this myth. There are many symptoms to look for. There are many early warning signs before you may even get a high blood pressure reading or have a doctor say that there's protein in your urine. So let's break it down. Some symptoms may seem pretty common, and I think that's why a lot of women don't think they're symptoms. They can be fatigue, they can be dizziness, they can be having terrible headaches that don't go away. They keep on getting terrible headaches every day. It can also be upper back pain. It can also be pain in the abdomen. It can be many different things, even nosebleeds, okay? This is something a lot of women do not know, that nosebleeds is a sign of low platelets, and it can be a sign that you're moving towards HELLP syndrome, which is a rare form of preeclampsia. So I want to give you this information so that if you see any of these warning signs, and also edema is a big one. Edema is when you have swelling in your hands. They get really big. You can't fit your rings on anymore. It's very uncomfortable. They're swelling up. And also your feet are swelling up. You can't get into your shoes anymore. It can also be your legs as well. So edema is a big sign that it's progressing into preeclampsia. It's not always the sign of preeclampsia. Some women do develop edema, but we're looking the whole system. And if you're having a lot of these symptoms, also rapid weight gain, okay? Women are expected to gain weight in pregnancy. But if you are gaining weight rapidly during the pregnancy and you have several more months to go, but you feel completely heavy and drained and you can't imagine gaining any more weight, again, sudden, rapid weight gain can be a sign. Okay, so I want you to address these concerns with your doctor if you see these symptoms, if you see several of these symptoms, also going in and out of consciousness. This sounds very scary, and it is scary, but this can be a sign of HELLP syndrome, and also having issues with your heart, not being able to breathe, feeling like there's a heaviness on your chest, like an elephant sitting on your chest. This is a sign that you need to go to your doctor or go to the ER very soon to have yourself checked out. Okay, so please spread the word. I am trying to create a movement called the Pre-Motherhood Movement. If you're not familiar with me, my name is Christy Rich. I'm a holistic health practitioner. I've been a holistic health practitioner for 20 years, and now I'm writing a 3-book series on maternal health and childbirth through a holistic perspective. And I want to empower you before you become pregnant to know about different maternal illnesses and how to prevent them. I want you to know about the possible symptoms. I want you to know how to treat it naturally. And so I invite you to share this video, to share this knowledge with other women. You may know other women who are currently pregnant and maybe even having some of these symptoms, and their doctor is saying, oh, that's just part of pregnancy. Okay, I don't want you to feel like you're surviving through pregnancy. I want you to feel that you are thriving and that you have enough information to make informed decisions. So share this information, follow my page for more information, and join the Pre-Motherhood Movement. Thanks for watching.